everyone. I'd like to make a demonstration about the wireless vital sign monitoring inside the hospitals use case by Korean Consortium for the midterm review of the 5G ERS project. First, I'd like to illustrate the use case briefly. The wireless patient monitoring inside the hospital use cases is a enhanced version or extended system of traditional PERS system. PERS means Personal Emergency Response System. We are focusing the wireless to improve wireless patient monitoring inside hospitals using various kinds of connectivity, such as Bluetooth and Wi-Fi, and especially 5G. Using various kinds of connectivities we can do by selecting the appropriate communication protocol depending on situations. We can reduce the power consumptions of wearable devices. We can assure the reliability of the vital sign transmission to a server. And especially we can send the emergency messages within a golden time. There are three components. First, the ERS band. ERS band is weighed by a patient. ERS band is measuring the vital signs continuously or regular basis. Also, ERS band had a help button. So a patient can press the help button to send emergency signal to caregivers. Using the 5G and the other kinds of communication technology, the signal to transfer to a server in right time and with reliable channels. We can also focus on the HL7 fire standards to think about the interoperability of ERS between the ERS system. Okay, we developed first ERS band and the ERS gateway and the ERS server. Okay, now I'm gonna do some introduction of the components, and after that, I can show you a demonstration. Okay. First, this is a ERS band. A patient is wearing this ERS band on the wrist, and this ERS band is measuring the vital sign, and it has a help button to send emergency signal. And second, this is a ERS gateway. It looks like a Wi-Fi hub, but it's especially for the ERS services. The ERS gateway and the ERS band has the various kinds of connectivities. For ERS band, there are three kinds of connectivities available. It consists of two electronic boards. One is this main board and the other is the LT board. The main board has the Bluetooth and Wi-Fi connectivities, and this board has, at this moment, it has LT module, but when the 5G module is available, we're gonna replace the 5G mode, the LT module with the 5G module. Okay, now let's start the demonstration. But before starting the demonstration, I'm gonna introduce the participant. First, the Mr. Kwon for nurses at nursing station. And second, the caregiver, Mr. Park for the caregiver. Mr. Park, please wave your hand. And for the patient, for me, myself, for the patient. Okay. Let's start the demonstration. This ERS band is measuring heart rate on a regular basis. For example, every 5 minutes. Okay, we have the heart rate as 89, and this ERS gateway received the heart rate, and then it forwards the heart rate reading to the server. Okay, let's see if the heart rate reading is delivered to the server. Mr. Kwon, please show the website. Okay, let's see the heart rate. for the patient 1. Okay, so we have 89 at this moment. Okay, now for the emergency messages. Before pressing the emergency message, first we're gonna see the caregiver smartphone. The message was delivered previously. Okay, now I'm going to press the help button. The emergency message immediately transfers to ES gateway, and the emergency message delivered to the server and caregiver smartphone. Okay, let's see the caregiver smartphone once again. And we can see the alarm message at the website, as well as the SMS message at the caregiver smartphone. Okay, the demonstration is completed. Thank you for your attention.